And now, ladies and gentlemen, we have our first session in this conference titled Patient Experience Introduction. And the first lecture in this session will be delivered by Dr. Suzan Frampton, President of Planetary. Planetary Model of Person-Centered Care, History and Current Practices from Around the World. Dr. Suzan Frampton is the president of Planetary International, a non-profit advocacy and membership organization that works with a growing network of healthcare provider organizations across the continuum to implement comprehensive person-centered models of care. Dr. Frampton, a medical anthropologist, has authored numerous publications, including the 3 editions of Putting Patients First, and served as lead author on the National Academy of Medicine's Harnessing Evidence and Experience to Change Culture, released in early 2017. Please join me in welcoming to the stage Dr. Suzan Frampton.
Thank you very much. It's a pleasure to be here. Just want to make sure I understand the technology. So if I press this button, will slides appear? They will. Okay. Again, it's my honor to be with you, and I want to thank our generous hosts at Al Musa Specialty Hospital. It's been a wonderful opportunity to work with them over the past several years. And I've been asked to share a bit of the history of the patient-centered care movement, because as much activity as we're seeing today, which is really wonderful, it's actually taken us about 4 decades to get to this point. So there's some interesting background, and I'll cover that quickly. And then more importantly, many, many new approaches that we're seeing taken up across the world. And that's the most exciting work. So as some of you may be aware, patient-centered care really did begin with patients, with patient advocacy, with patients coming forward and saying, we're not satisfied with our care experience. And one of those patients, one of the very first patients who came forward and said this, was an Argentinian woman, Angelica Thiriet, who is the founder of Planetary, which is the first patient-centered care advocacy organization that was established in the United States back in the 1970s. And I want to remind us all that back in the 1970s, none of us had access to the internet. So imagine if you were a patient with a diagnosis trying to understand what was happening to you, and there was very little information available to people. And that was certainly this young woman's impression. She had a life-threatening fever of unknown origin. She was admitted to a hospital. At that time, very little information was shared with patients. She was very fearful. She didn't understand what was happening to her. She felt very much that her care was impersonal, that people didn't really know who she was. In fact, she said in the week that she spent in the hospital, it wasn't until 3 or 4 days into that visit that someone finally called her by name. That to her was like a light bulb going off, that it was so important for the doctors and the nurses to treat each patient as an individual, to personalize their care, to humanize their care, to make sure that as wonderful and important as the medical science and technology is, that human bond, that bond of trust, that patients must put in their healthcare team is absolutely essential as well. And so much of the work that Planetary has done over the years has focused on that essential element of healthcare delivery, that personalized, demystified, and humanized part of healthcare. And so when Angie Thiriet first met with other patients and said, what is it that's missing from this healthcare experience? They came up with a model that they felt addressed many of the things that they thought in formal healthcare there needed more attention. So everything from compassionate human interactions to involvement of their family, their friends, their social support network, to looking at the actual built environment and what elements of the built environment could potentially better facilitate a healing environment and a healing experience. So they developed this model. They went out and they experimented in a number of healthcare systems around the United States. And over time, the Plaintree model, as it came to be known, was adapted and adopted in many countries around the world. And today, there are 24 countries that are using the Plaintree model as a framework to implement excellence in patient and person-centered care. This model is also recognized by the World Health Organization, and several years ago when WHO said we need to be developing a people-centered focus for the work that we do around the world, Plaintree was a part of the first expert consultation group helping to inform WHO, making sure that the focus was always on the patient voice, listening to patients, integrating their needs, their preferences, and their values into the way that we deliver healthcare. The basis of our work in the world is always to begin by listening to patients. And through focus groups, interviews, observations, we continue to collect data on the trends that we hear from patients, on the main concerns that we hear from patients. And they continue to be grouped around three specific areas. One is patients feeling that they're not listened to, that they are not really treated as full partners when they interact with a healthcare team. And that's so important to them and to their care. Another is the absence of true caring and kindness in the way that the healthcare team sometimes interacts with patients. That need for compassion, for empathy, for support when a person is ill. And then lastly, lack of continuity of care. Many patients feel confused about what they hear from various professionals. They need to know, what is my plan and how can I be more involved and engaged in that? And so these concerns have helped to shape our very definition of patient-centered care, of person-centered care. One of the first formal definitions was released by the Institute of Medicine, one of the most respected policy bodies, certainly in the US. And they define what a patient-centered care experience should be like, that focus on respecting the values and the preferences of a patient. This past year, we had an opportunity to collaborate with the National Academy of Medicine to update this definition. So we have a 2017 version. It's much longer and much more detailed. So things don't tend to get simpler, they kind of expand. But I think the important thing is to notice the difference, that we've gone from saying we should be patient-centered and we should be respectful, to talking about true patient engagement, that we must actively engage with patients and their families. We must actively partner with them to better elicit what their values, their preferences, and their needs are. And that the only really great healthcare is healthcare that is organized around those needs, preferences, and values. Because at the end of the day, who are we developing a treatment plan for? Who are we delivering healthcare for? It's for that individual patient. And we need to take the responsibility to understand each person lives a separate life. They have their own reality. And we can have wonderful plans that work for us as professionals, but unless it also works for the patient at home, where they live, in their community, in their family, then it's not optimal healthcare. And that is a challenge. So much of the work being done now in the world of patient-centered care and patient engagement is focused on taking that experience of patients, the things that they've been telling us for a very long time, and combining it with the growing evidence base for patient-centered practice, for patient engagement. And again, this was a project with the National Academy of Medicine that we entered into last year to do that very thing, to answer the question, where is the scientific evidence that supports patient-centered approaches to care delivery? And I'm very happy to say there is a very, very strong and growing evidence base for many of the practices that for years we had to rely on the patient's experience in our work. And so I want to just share a few examples of some of these things from around the world. And I'll start where most great initiatives must start. They must start with dedicated visionary leadership. I do believe that in order for patient engagement and person-centered care to be effective, we must have leadership in our healthcare delivery organizations that understand and embrace these concepts. You have a wonderful example of that right here at Al Musa Specialty Hospital. And I believe Malik Al Musa has done an excellent job as that visionary leader who not only promotes and supports the concepts, but within that organization, as we say, walks the walk, doesn't just talk the talk. Someone who serves on the patient-centered care steering committee, a leader who attends every employee training on patient-centered care to send the message that this is very important to me. A leader who goes and visits with patients, makes rounds on the wards. A leader who supports the structure of patient and family advisory councils, inviting those you serve, patients and families in, to help advise us on the best ways to improve care delivery to them. A leader who takes that advice and makes sure that it's reflected in the organization's strategic plan. So these are some very important ways that leadership supports patient-centered care and engagement of patients. Also understanding that at the foundation also of patient-centeredness is staff-centeredness. And these are colleagues in Malaysia and Kuala Lumpur at KPJ Health System that have reached out to their staff and said, we want you to be able to be your very best, to do the very best for our patients. How can we support you to be able to be your best? And they took their employees' feedback and they've created a wonderful workplace where they have an on-site childcare center for their employees, where employees are able to design their own reward and recognition ceremonies. They get to really design their own parties where they dress up, they have a lovely time together. The organization offers free health screenings to its employees as well. So they care for their caregivers so that their caregivers can care for patients. And so that caring for patients in many ways focuses on the need to improve communications with our patients, because this is where often we fall short. We have a wonderful ability to apply our wonderful science and technology, but communication is also an essential skill to delivering high quality, safe care. And so promoting access to information for patients and families is a very, very essential focus in patient-centered care. And so we know, for instance, that providing access to the medical record, to medical information directly to patients is extremely important. This is just an example from one of our hospitals, actually the hospital where we're headquartered in the United States, that was one of the leaders in giving patients direct access to their medical records. And in every one of the patient rooms in this hospital, you see a sign that says, this information is yours, please ask. We want you to be able to see your record real time while you're here with us, to read, to ask us questions about it. And what we find is when we have that transparency, that patients, when they then rate the hospital on overall care, tend to rate the hospital higher. The next move of this is giving true access to patients not only while they're with us in the clinical setting, but giving patients access and engagement the way they want to engage. And today, for many people, they don't want to have to come in to see us. They want their information easily accessible to them in their home, on their smartphone, over the computer screen. And so more and more we see patient portals that are designed not for patients, but with patients, with patient input, so that the portals are easy for people to use, that they can access the information that's most important to them. And this is actually my patient portal that I've shared. On this portal, I can email and text my physician. I can have a conversation over email. I can set up appointments. I can access all of my laboratory results. And this is how, as a patient, I want to engage. And I know that more and more patients are hoping that they will have these opportunities to engage as well. Another form of important communication, another opportunity we have in the acute care setting, is through bedside shift report. And I know some of you out there have probably adopted this practice, where instead of the nurses leaving the room to have their shift change conference to talk about what happened with the patient the 8 hours prior, what the plan is for the next 8 hours, to have that conference at the bedside. And not just with the patient listening, but with the patient, to the extent possible, contributing to the conversation, to their family or their care partner also being involved in that conversation. So that again, we give the message to the patient, this is information that's critical to you. We want you to be involved in this. And we know that there's a great deal of benefit when we share information like this with the patient. There's some results of a study that was done at a hospital over a 12-month period. They looked at the patient's ratings of their nurses, different aspects of nursing care, before they implemented bedside shift report, and then 6 months after. And you can see there's consistent improvement in the way that patients feel cared for, the extent to which they feel respected and listened to when that exchange of information happens with their involvement. Another area for improved communications is shared decision-making. And we're seeing a movement around the world focused on shared decision-making. This is a very formal process when there is a preference-sensitive condition, to have a conversation with the patient to help them to understand what the risks and benefits are of various treatment options, and then to help them come to a decision that works best for them, given their lifestyle. This is an approach that's being used, as I said, in many places. One important example, and this is our Plantree Brazil partners. In Brazil, as many of you may be aware, they have some of the highest cesarean section rates in the world. And this does not bode well for many women. It contributes also to increased maternal mortality. So launching an education initiative that includes engagement of the patient, of sharing information about options and what the health impact might be, is helping to bring those C-section rates down. Two other practices that are also very important in supporting patient-centered approaches to care. These are not always the easiest ones, but I know there's quite a bit of progress being made on this as well. One is patient-directed visitation, where the patient is the one that sets the guidelines around who will come see them while they're with us in the healthcare environment and when they will be allowed to be there. I do a lot of web surfing. I like to go and look at hospitals' visitor information sections of their website. So I know that the vast majority of hospitals have very strict guidelines and limitations on visitation. This is actually one of those, this is not a restrictive one. This is when I went out and I looked at Musa Specialty Hospital's patient visitation language, and you can see this is a very different approach to visitation. This is an approach that honors the patient's needs and their views of who is most important to be with them, while at the same time recognizing the need for quiet hours during the night. So I was really heartened to see this, because I have to say this is one of the most challenging things. And even in the United States and some of our most esteemed institutions, this is still not the norm. In fact, my husband had to have spinal surgery earlier this year, and we found the best orthopedic spinal surgery center in the New York metropolitan area. And I went on their website, and I found that they would not let a family member stay at the bedside overnight. So I called their chief experience officer, and I had a long conversation And I used some of the data that we had compiled from the National Academy of Medicine paper to make my case, and I did stay at my husband's bedside. However, I slept on a windowsill. So I wasn't really welcomed, I was tolerated. But that's important, so we have to keep pushing and making steps forward so that these things change. This is some of the research that we've compiled around, and I can't actually read it, the impact of visitation. And this is a part of what I shared with that chief experience officer, that there's really quite a bit of an important case to be made for safety and quality improvements when we have family there at the bedside. Also, families being more involved in the care of patients as a care partner, another one of the programs that Planetree has promoted for a very long time, asking patients' families to what extent they would like to be involved in care, and we know that it has many different benefits than for the patient. And then last example, the impact of the built environment. This was based on quite a bit of research, most notably that done by a physician at Yale University, looking at what does the actual hospital environment do to impact the patient's health and wellness. And in this study, what was resulted was the description of something called post-hospital syndrome, where the researchers found that the vast majority of readmissions within 30 days after a patient had been discharged were not a repeat of the initial diagnosis, but actually some other problem caused simply by being in the hospital environment itself. So we know that hospital environments pose risks to a patient's health. We disrupt sleep regularly. There's a lot of loud noises, lighting that is not conducive to rest, quite a bit of uncertainty, patients not knowing what's coming next. And so we have opportunities within the built environment to make changes that can support a more person-centered healing environment. Everything from the emotional support that comes with having a family member there and actually having space designed for that family member so they're welcomed, to improve nourishment. And this is another area where we need to challenge our own thinking. We need to look for the evidence. When we have prohibitions on food and liquid before tests and procedures, we need to ask ourselves, where's the data that actually suggests that that is needed? So again, many different ways that we can support our patients. And that, I think, is one of my final comments. There are indeed many, many pathways that we can take to improving the patient experience, to improving quality, safe healthcare through the engagement of patients. I think the challenge for all of us is to decide, where do I start? What do I do? How do I do this? What's my pathway? And this is some of the work that Planetree has been focused on over our 4 decades of work in the world. And we've taken a lot of the learnings from the hundreds of sites in many different countries that we've worked with and finalized a set of standards for patient-centered accreditation. And this is, at this time, the only patient-centered accreditation that is available. It's very rigorous, as those of you, I know there are some of you in the audience that have begun to do self-assessments around the Planetree designation standards, but it's very much focused on a philosophy of patient engagement, sets of standards tied to that philosophy, and being able to demonstrate by listening to patients that these things are actually happening. And I want again to congratulate our wonderful sponsors, the Al-Musa Specialty Hospital, as we each year at our annual conference, which was held last week, we honor the organizations that have achieved excellence in person-centered care. And as you can see, there are quite a few of them, a growing number around the world, but it was particularly an honor to have Malik Al-Musa and his leadership team and to honor them last week in Baltimore. So I would say person-centered care, patient-centered care, it's a concept whose time is here, and it is certainly and honored to see so many people, I know a greater number of people than anticipated, who are interested and enthusiastic and committed to making it a reality in the Kingdom of Saudi Arabia. So thank you so much.
Thank you indeed, Dr. Susan, and I apologize for bothering you with the time.